Gentlemen, let's talk about something most men never say out loud. If you're over 50, 60, even 70 and you still masturbate, I know the questions that creep into your mind late at night. Is this still healthy at my age? Am I hurting my hormones? Could this damage my prostate? Am I secretly weakening myself as a man? These thoughts may feel private, but I want you to know, you are far from alone. I can't count how many men have sat across from me, their voice dropping to a whisper, asking me that exact same thing. The truth is, older men are surrounded by myths. Maybe you grew up hearing that masturbation drains your energy, ruins your testosterone, or makes you less masculine. Maybe culture or religion layered guilt and shame over something completely natural. Or maybe you've read alarming claims online that left you confused, wondering what's real. And here's the problem. When no one gives you real answers, that quiet doubt eats away at your confidence. But I need you to hear this clearly. Modern science tells a very different story. Far from being harmful, masturbation, when done consciously, can be protective, empowering, even therapeutic. It's not a sign of weakness. It's maintenance. It's confidence. It's self-respect. Like any tool, it can help or harm depending on how you use it. And when you understand the truth, you'll see that this private habit can actually safeguard your prostate, support your circulation, strengthen your pelvic floor, and even lift your mood. That's why I'm here. I'm Dr. Laura, and for decades I've helped men over 50 reclaim their vitality, restore intimacy, and protect their health, naturally. And today I want to give you something you've probably never had before. Clarity. By the time we're done, you'll know the 10 surprising benefits of masturbation after 50, the 10 risks that can sabotage you if you're not careful, and the exact steps to make sure this practice works for you, not against you. So lean in, because this is a conversation you won't hear anywhere else. Gentlemen, you deserve answers grounded in science, not shame. You deserve confidence, not confusion. And you deserve to enjoy your body without fear. Before we dive into the benefits, do me a favor. Hit like, subscribe, and drop your questions in the comments so I can help you directly. That small action keeps this channel alive, and it helps other men just like you find the truth instead of drowning in myths. Now let's start uncovering what really happens when an older man touches himself, and why the truth might surprise you. Gentlemen, let's move past the myths and get straight into the facts. Science paints a very different picture than the warnings you may have heard in your youth. When practiced with awareness, masturbation is not a guilty indulgence. It's a form of self-care. For men over 50, it can protect your health, restore your confidence, and even add years of vitality to your life. Here are 10 surprising benefits you may never have been told. Benefit number 1. Maintains penile health. Every erection is like a workout for your penis. Fresh blood enters the erectile tissue, keeping it elastic and preventing scarring or fibrosis. Put simply, use it or lose it. Benefit number 2. Protects the prostate. Harvard researchers found men who ejaculated at least 21 times a month had a 33% lower risk of prostate cancer. Why? Ejaculation flushes out old fluid, toxins, and inflammation from the prostate ducts. Benefit number 3. Strengthens the pelvic floor. Those contractions during orgasm? They're exercising the same muscles that support erections, bladder control, and sexual stamina. A stronger pelvic floor means stronger erections and more control. Benefit number 4. Lowers stress. Orgasms reduce cortisol, the stress hormone. Lower cortisol means lower blood pressure, a healthier heart, and a calmer mind. Benefit number 5. Boosts mood. Dopamine and oxytocin are released at climax. These brain chemicals improve mood, fight depression, and bring more patience and positivity into your relationships. Benefit number 6. Improves body awareness. By regularly touching yourself, you learn what feels normal. That awareness helps you detect early signs of trouble, like lumps, curvature, or unusual pain, that might indicate serious disease. Benefit number 7. Enhances sleep. After orgasm, prolactin rises and cortisol falls. It's the perfect hormonal recipe for deep, restorative sleep, something many older men struggle with. Benefit number 8. Increases pelvic circulation. Beyond erections, masturbation boosts blood flow through the entire pelvic region, keeping tissues healthy, supporting the bladder and reducing stagnation. Benefit number 9. Trains control. If you've ever worried about finishing too quickly, masturbation is the safest place to practice the stop, start or squeeze methods. This builds awareness of arousal and greater confidence with a partner. Benefit number 10. Keeps desire alive. The brain is the biggest sex organ. Regular stimulation keeps arousal pathways active and prevents sexual shutdown over time. Even if you don't currently have a partner, it ensures you're ready when intimacy does arrive. Gentlemen, do you see the bigger picture here? These aren't signs of weakness. They're proof that your body is still capable of vitality, if you use it wisely. Masturbation after 50 isn't something to hide in shame. It's a natural, powerful tool for preserving your health, protecting your prostate and keeping your confidence strong. Gentlemen, as encouraging as the benefits are, we need to be honest about the other side of the coin. Masturbation is a powerful tool, but like any tool, it can build or it can harm depending on how you use it. Practiced carelessly, it can quietly erode your health, confidence, and relationships. So let's go through the 10 most common risks older men face when they get it wrong, and how to avoid them. Risk number 1. Social isolation. If self-pleasure becomes a replacement for human intimacy, you can slowly drift into loneliness. Physical release is not the same as connection, and over time, that gap can weigh heavily on your emotional health. Risk number 2. Skin microtears. Too much friction, especially without lubrication, can cause tiny tears in the skin. These lead to irritation, inflammation, and even infection. Treat your skin with care. It's not indestructible. Risk number 3. Desensitization. Using the exact same grip, pressure, or speed every time trains your brain and body to respond only to that one method. Suddenly, nothing else feels good, not even real intimacy. Variety keeps your sensitivity alive. Risk number 4. Masking erectile dysfunction. Some men find they can perform solo but not with a partner. That's not a harmless quirk. It's a warning sign. Could point to diabetes, vascular disease, or low testosterone. Ignoring it delays treatment that could protect your health. Risk number 5. Nerve compression. Poor posture, like hunching forward on a hard chair, can pinch the pudendal nerve. Over time, this leads to pelvic pain, numbness, or reduced sensitivity. Your body position matters. Risk number 6. Emotional escapism. If masturbation becomes your only way of handling stress or loneliness, it can turn into a dependency. Pleasure should complement your life, not replace other healthy coping strategies like exercise, friendship, or meditation. Risk number 7. Guilt and shame. Many men grew up with cultural or religious messages that painted masturbation as dirty or wrong. Carrying that guilt into older age corrodes self-confidence. The truth is, your body is not your enemy. Risk number 8. Pelvic congestion. Just as too little ejaculation is unhealthy for the prostate, too much can also cause problems. Overdoing it multiple times a day for weeks creates a feeling of heaviness, ache, or pelvic discomfort. Moderation is key. Risk number 9. Reduced semen quality. If you're still trying to conceive, frequent ejaculation can lower sperm concentration in the short term. Studies show 2 to 5 days of abstinence produces the healthiest semen quality. Risk number 10. Porn dependency. If your arousal depends only on extreme or artificial stimulation, your brain may struggle with real-life intimacy. It's easy to condition your mind to fantasy, but hard to recondition it back to reality. So here's the bottom line. Masturbation itself isn't dangerous. Unconscious masturbation is. When you treat it as a mindless escape, it can trap you. But when you approach it with awareness, it remains a tool for health and vitality. Gentlemen, by now you can see masturbation isn't the enemy. It's how you approach it that matters. After 50, your body is different. Hormones shift, blood circulation slows, recovery takes longer. That doesn't mean pleasure disappears. It means you need a smarter, more conscious approach. So let's lay out the blueprint for safe, healthy masturbation after 50. Rule number 1. Practice moderation. A few times a week is healthy. Multiple times every day for weeks at a time can backfire, causing pelvic congestion, soreness, and fatigue. The goal isn't to chase numbers but to listen to your body. Rule number 2. Use lubrication. Your skin isn't as resilient as it was at 20. Dry friction creates microtears and irritation. A simple water-based lubricant can transform the experience, protect your skin and keep you comfortable. Rule number 3. Vary your technique. If you always use the same grip, rhythm or speed, you train your brain into one narrow pathway. Change things up, switch hands, adjust your pressure, focus on slower strokes. Variety prevents desensitization and keeps sensitivity alive. Rule number 4. Pay attention to posture. Don't hunch forward for long sessions in a hard chair. That compresses nerves and strains your back. Instead, recline or lie down, support your body and keep your muscles relaxed. Your nervous system will thank you. Rule number 5. Stay mindful. The purpose isn't just release, it's awareness. Notice your breathing, your tension, your state of mind. Masturbation done mindlessly can become escape. Masturbation done mindfully becomes self-care. Rule number 6. Limit pornography. Extreme visual stimulation rewires your brain, making real-life intimacy harder. Use it sparingly, or better yet, rely on imagination, memory, or sensual touch. Your brain needs reality as much as fantasy. Rule number 7. Combine it with lifestyle habits. Sexual health doesn't exist in a vacuum. Exercise strengthens circulation, nutrition fuels hormones, sleep restores energy. When paired with those, masturbation becomes part of a larger, powerful formula for male vitality. Rule number 8. Watch your emotional signals. If you're turning to masturbation because you feel lonely, anxious, or stressed, it's time to expand your coping tools. Call a friend. Go for a walk. Meditate. Don't let it become the only way you handle life's weight. Gentlemen, masturbation after 50 isn't about chasing youth. It's about aligning with your body's current reality. Done the right way, it preserves erectile strength, protects your prostate, enhances mood, and maintains intimacy. Done carelessly, it can erode all of that. So choose wisely. Treat your body with respect. And remember, safe, mindful masturbation isn't weakness. It's wisdom. It's maintenance. It's the foundation of lasting confidence. Gentlemen, now that you understand both the benefits and the risks, the real question becomes, what do you do next? Knowledge is only power if you put it into action. And that's why I want to leave you with something practical. A 30-day conscious practice challenge. For the next 30 days, I want you to approach masturbation not as a guilty habit, not as a mindless escape, but as an intentional tool for health and vitality. Here's how. Step 1. Set your rhythm. Aim for 2 to 4 times a week. Enough to keep blood flow and prostate health strong, but not so frequent that you drift into congestion or fatigue. Listen to your body's signals. Step 2. Protect your skin. Use a quality water-based lubricant every time. Treat yourself with the same care you would bring to a partner. Step 3. Change it up. Vary your technique, pace, and posture. Keep your brain and body flexible so you don't fall into desensitization. Step 4. Stay mindful. Breathe deeply. Slow down. Notice how your body responds. Let it be an active presence, not just release. Step 5. Reflect afterward. After each session, ask yourself, do I feel calmer? Did I sleep better? Do I notice stronger erections, less tension, or more confidence? Track the changes. Here's what you'll discover. After 30 days, your relationship with your body will be transformed. You'll feel stronger, not weaker. Calmer, not drained. More confident, not ashamed. Your prostate will thank you, your mood will steady, your sleep will deepen, and you'll carry that sense of vitality into every part of your life. Gentlemen, this is not about chasing youth. This is about embracing wisdom. At 50, 60, or 70, your body isn't done. It's asking for a different kind of care. Masturbation done with awareness is not weakness. It's maintenance. It's confidence. It's the choice to respect your body instead of fearing it. And let me remind you of this. Age does not define your masculinity. Awareness does. Respect does. Action does. The shame you may have carried since your teenage years has no place here. Science, health, and self-respect are on your side. So here's my invitation. Start your 30-day challenge today. Give yourself permission to experiment, to listen, and to learn. Drop the myths. Drop the fear. Step into clarity. I'm Dr. Laura, and my mission is to give men over 50 the truth you've always deserved. If this conversation spoke to you, hit like, subscribe, and drop your questions in the comments so I can help you directly. And for the full breakdown with step-by-step guidance, check the pinned comment below. I've left everything you need there. Stay strong, stay confident, and never forget, you are not broken. You are a man with years of vitality still ahead. Let this be the chapter where you finally embrace your body with clarity, respect, and courage.